Hello, beautiful people. Welcome to Dorivan OSCE, your pathway to OSCE success. Today, we are going to have a lecture series on neurological assessment of the OSCE assessment station. And basically, it's about subdural hematoma. We already have a video of this station in our channel. So if you want to have a look at it, feel free to watch it. And then if you are new to this channel, please subscribe, like, comment, and share so that others can also have access to the video. Thank you so much. So this video is just a lecture series of what is required of candidates to complete the station. The station is 20 minutes, so you need to use 20 minutes to complete the station. So this video will explain what you need to do, what you are likely to meet, and how you can go about the station to pass the station. So stay tuned and watch to the end. Thank you. All right. So in the station, these are the equipment that you are likely to meet. So you meet or you need your scenario. So the scenario will be given to you, and then the GCS chart. So you'll be completing a GCS chart as part of this station. You need your blood pressure and then pulse oximeter. So this is how it looks like. And then you will need infrared thermometer. So that's the infrared thermometer. You also need a fob watch, which you use to time your pulse and your respiration. And then you need a pen torch to check your pupil size and how they react to light. So these are the equipment you are likely to meet, or these are the equipment you meet or you need to complete the station. All right. Now, I have segregated or arranged this station in 6 phases. So in each phase, there are a set of things that you need to do to complete the station within the 20 minutes time frame. So phase 1 is just where you are going to ensure the scene is safe for you and your patient. So when you approach the scene, you confirm that you can confirm your scene is safe to approach, and then it's safe for you and your patient. And then you ensure you provide privacy for your patient. So you have to draw the curtains, even though there might not be any curtains, but just perform an act. I perform privacy for my patient by drawing the curtain. So just perform an act that you are providing privacy for your patient to maintain dignity. And then you perform your hand hygiene according to WHO standard. So there will be hand sanitizer at the station. So you put an ampoule of gel in your hands, and then you apply palm to palm, right hand over the left dorsum and vice versa, fingers interlaced, fingers interlocked, rotational rubbing of the thumb, tips of the fingers, and your wrist, and then you leave it to air dry for 30 seconds. So right after performing your hand hygiene, you can now read your scenario and then approach your patient to introduce yourself. So introduce yourself. Let's say, hello, my name is Evans. I'm one of the nurses who will be looking after you today. And then you do your ID check. The ID check, you ask of the patient's name, date of birth. Then you have to compare it with the patient wristband and the document or your scenario, the name or the details of the patient on your scenario. So you have to compare them while you are reading simultaneously. And then you have to gain consent for the procedure. So you explain to the patient what you are going to do. So you are going to perform an A to E assessment using the GCS chart. So basically that's what you're going to do, and then you seek the patient consent if the patient is okay with that, or if it is a convenient time for the patient, and the patient will confirm. And then you ask which name the patient prefers you to call. So if let's say the patient say he or she is called Joe Smith, you ask if the patient is okay if you address him or her as Joe. Do you get it? So you request for the name the patient would like you to address him or her. And then you check for the patient's allergy. So if the patient is having any allergy to drug, litters, food, or anything, so the patient will tell you, and you have to acknowledge that because the patient might be wearing a red wristband. So you check for the allergies and what reaction the patient gets in case he or she comes in contact with those allergies. Give reassurance that throughout the patient stay in the hospital, he or she is never going to be given anything containing that allergy or allergen the patient is allergic to. All right. So from there, you have to check if the patient is in any form of pain or discomfort. So if there is, you rate the pain in a pain scale of 0 to 10, where 0 is no pain, 10 is the highest level of pain, and the patient might give you, let's say, 5 or 10, whatever pain score the patient gives you. Try and then provide some comfort or some intervention. So you ask if the patient has taken any pain medications, and if not, you just reassure by giving some non-pharmacological pain treatment like repositioning, deep breathing exercise, and then you reassure the patient that you'll be checking the medication administration records to see if the patient has any pain medication, and you will be happy to give to the patient. So you proceed by giving all these interventions, or if the patient is not having any pain medication, you can just inform the patient that you inform the doctor to prescribe analgesics for the patient. So that is for checking for pain or discomfort. And then sometimes you might meet some traps at the scene. So for example, you might meet a patient that is having hearing aids, glasses, cigarettes, or lighters at the bedside. So you have to show consent. So a patient might need his or her hearing aid in order for the patient to be able to hear what you are saying. So you ask if the patient might need it, or the glasses, if the patient might need the glasses. Then if you see something like cigarettes or lighter, hospitals are non-smoking institutions. So you inform the patient that the hospital is non-smoking institution. So you have to take the cigarette and the lighter away from the patient and then keep it safe for the patient, which you'll be handing over to the patient later on or after the patient has been discharged or whatever. So try and identify if there are traps around the patient bedside. So before you leave the patient to organize the equipment you need, just leave the call bell that the patient should ring or use in case the patient wants to you to do something for him or her. So you leave the call bell and then you leave the patient. And then you ask the assessor to confirm if your equipment, that is your blood pressure device, and then the infrared thermometer or the device you need for the procedure has been cleaned, calibrated, and ready for use. So the assessor will confirm that for you. Then you perform your hand hygiene again according to WHO standard. You put an ample of gel, palm to palm, back of the hands, fingers interlaced, fingers interlocked, fingers interlocked, rotational rolling on the thumb, and then tips of the fingers and your wrist. You leave it to air dry for 30 seconds. And you ask your assessor if you need PPE for the station. If you need PPE, then you put on your apron and your gloves before returning to your patient. So when you do these things, you have completed the phase 1. Now let's move to phase 2. So for phase 2, it starts from where you've returned to the patient, and then you let the patient know you are back. Hello, mention patient name like Joe. Hello, Joe, I'm back. Are you happy for me to proceed? Joe will say yes. And then you tell Joe that you'll be starting with the GCS chart. So starting with the GCS chart, you can start with the eye opening. So looking at what happens if the patient opens the eye spontaneously. You just mentioned when I came in, you open your eye spontaneously, and I'm going to give you a score for it. So you check the score on the GCS chart. You can give the score. for the spontaneous eye opening. And then you look at the verbal response. So for verbal response, you are checking for whether the patient is oriented to time, place, and person. So you ask these three questions. Um, whom you are, so you are the nurse, but just ask the patient whom you are. If the patient is able to answer, then it means the patient will return to person. But if the patient is not, then it could be patient is oriented to person. So you ask the patient whom you are, where the patient is, and then what time of the day it is. So these are the three questions you ask. Sometimes the patient might not be able to answer them, so you can say that the patient is disoriented to time, place, and person. You reassure that you'll be orienting them to time, place, and person. And then you give a score of disoriented on the GCS chart. Then you move to best motor response. So with the best motor response, you are just checking whether the patient is able to respond to stimulus, or like if you ask them to do something, if they'll be able to do. So sometimes you can just ask them to pull out their tongue, or you ask them to grab your hands and let go and all that. So you're just checking the best motor response. Well, after that, you give a score for that, depending on whether the patient obeys commands or whatever. So you give a score for the best motor response. Then you move to checking of the pupil size and how the patient react to light. So that's where you're going to use your pen torch. So on the side of the pen torch, you see some circles that indicates like the pupils sizes. So you let the patient either close one of the eye while you check the other eye, or you let the patient fix his or her eyes on your forehead, and then you check the size of the pupil for both eyes, the left and the right. So whatever size you get, maybe you get a size of 3. So you write at the pupil size for the left eye is 3, and then the right side, the right eye too is 3. And then you now check the reaction to light by lighting the torch on the patient's eye. So you do it for the left eye and the right eye. So the same way, you can let the patient close one of the eyes while you do the other eye, or you let the patient fix the eyes on your forehead. Then you flash the light from the outer contours to the inner contours. So from outside to inside, and then you bring it down, and you do it for the other eye. And then if the patient blinks the eye, it means there is what pupil reaction. So you give a plus for pupil reaction. And if there is no reaction, then that is you give indication of minus on the GCS chart. So let's move to the limb movement. So with the limb movement, you are checking whether the patient is able to move both upper and lower limbs. So you the nurse, you raise your arms, and then maybe you ask the patient to raise their arms as well and get to the level of your arms. So if the patient is able to get to the level of your arms, or maybe you can also ask the patient to you are going to apply pressure on the patient's arms, so the patient should try and resist you. So while doing that, you'll be able to detect whether the patient is having power in the upper limbs. So if there is power, then you give a score of, let's say if there's normal power in the right and the left arms, and then you move to the lower limbs, you do same. You raise your arms, you try to ask the patient to lift the legs to the level of your arms. If the patient is able to do that, or maybe you try to apply pressure on the legs, you have the patient try to resist you, and if the patient is not able to resist or able to resist, you give a score. So sometimes there might be power in both legs, or there might be maybe normal power in the left leg and there will be less power in the right leg. So you have to actually check that and then give a score for that. So that is where you've ended phase 2. So it means phase 2 deals with the checking of the GCS chart. So you have to complete all the GCS charts of the yes, so you complete the GCS chart, and then you move to phase 3. So with the phase 3, you are just going to check the patient vital signs or observations. So you are going to check the blood pressure, capillary refill, oxygen saturation, pulse rate, respiration, and then the temperature of the patient. So that's where you're going to check the patient's vital signs. So when you watch the video, you see how the patient's vital signs was checked. Let's move on to phase 4. So with the phase 4, that is where you are going to do you finish or you completed with the vital signs. So you're going to do the A to E assessment. So A to E assessment, A stands for airway. So with the airway, you are checking whether the patient airway is clear, there's no visual obstruction. You can instruct the patient to give you a cough. And if the patient is able to cough, you can confirm that the airway is clear, there's no visual obstruction. Moving to B, with the B, you are checking the breathing and the oxygen saturation. So you are going to give the score for the breathing and the score for the oxygen saturation. So you tell the patient the rate of the patient's respiration. Let's say it was 16 or 17 or 18 breaths per minute. So if it's within normal range, you say you are happy with the respiratory rate was within the normal range. You also inform the patient that you were checking, when you were checking the respiration, you also checked the rhythm and the depth of the patient respiration and the rise and fall of the chest, whether there is equal air entry or if the patient is using accessory muscles to breathe. So you have to inform the patient all this, what you observe on the patient. And you also check for respiratory noises. So whether the patient is wheezing or having stride or rattle or the patient is coughing. You check all these things during the respiration. And then on the oxygen saturation, you give the patient the oxygen saturation rate, whether it was within normal range. So usually if the patient gets, let's say 96%, 97%, you tell the patient whether it's within normal and then whatever you wanted to do. Let's move to circulation. So with the circulation, you are going to tell the patient about the blood pressure, the heart rate, and then the capillary refill. So with the blood pressure, what you had, whether it's 120, 80, and whether it's within the normal ranges, and then the heart rate, whether the heart rate is within the normal range, whatever you had, let's say 80 beats per minute, 70 beats per minute, and then you let the patient know that while you were checking the heart rate, you also check the rhythm and the strength, and whether they were all normal or you were happy about it. And then with the capillary refill, you check, that's where you are going to press the patient's nail bed to see whether you are going to press for 5 seconds and see whether it returns within 2 seconds. And then you can confirm the patient is not pale, the patient is perfused. So that is capillary refill. Still on the phase 4, you move to disability. So with the disability, that is where you are going to take the patient through the GCS chart. So we talk through about the eyes, what you observe on the eyes. That's whether there was spontaneous eye opening, the motor response, whether the patient was able to obey command, and then the verbal response, whether the patient seemed confused or oriented. So you give your scores for that, and then the pupil size of the patient and whether the size reacted to light. Then the limb movement, whether there was weakness or there was no weakness on the limbs. You also ask of the patient pain. If the patient is in pain, the pain score and what you might do to help the patient or control the pain for the patient. And then you ask of the patient urine output. So as the patient passed urine, is it normal, the color of the urine and all that. So you ask whether the patient has passed urine, and then bowel movement, something like that. You also ask about the blood glucose level of the patient. So usually you ask the assessor the patient's recent blood glucose level, and if whatever is given to you, interpret whether it's within the normal range or not. And then you go to the exposure. So with the exposure, you are going to tell the patient the temperature reading. So if it's, let's say, 36.2, 37.2, is it within the normal range, and you are happy about it or not, you tell the patient. And then you ask the patient if he or she is having any bleeding, injury, or rashes in any part of their body. So if there is, you let the patient show you where it is, but you are not allowed to expose the patient. The patient will just tell you where the injury is, or if there's none, the patient will tell you. Then you ask about the past medical history. So the past medical history is on the scenario. So you mention the past medical history on the patient scenario, and you ask if the patient has any past medical history apart from what you have mentioned. And the patient will tell you if there is any. Now we'll move to phase 5. So at phase 5, you are going to leave the patient after checking your GCS, your vital sign, and taking the patient to the A2E assessment. So you're going to leave the patient. You have to leave the call bell, and then you have to remove your PPE in case you were asked to put on a PPE, apron and gloves. You put them in the clinical waste bin. You perform your hand hygiene according to WHO standard, and then you complete your or document your vital signs and calculate your GCS chart. So after completing your GCS chart, you perform your hand hygiene again and then return to your patient to the final phase. So at this phase, you return to your patient and then you educate the patient on the GCS chart. So whatever score you had, maybe 14 out of 15 or 15 out of 15, you give the intervention. Let's say if it's 14 out of 15, you're going to monitor the patient every 30 minutes, and then you keep on orienting the patient to time, place, and person. And then maybe you escalate to the medical team and all the other multidisciplinary team that you might want to escalate the patient's care to. And then you move to activities of daily living. So you're going to ask the patient few things regarding the patient activities of daily living. So you talk about the physical. So with the physical, maybe the drug history, whether the patient is adhering to the treatment regimen or his or her drugs. And then you ask about the patient's mobility, whether the patient has an issue with mobility, bowel movements, nutrition, anything related to the patient's physical health. You ask them and then you give reassurances and interventions if appropriate. So if the patient, let's say, having pain, you can talk about referring to the pain management team and all the other multidisciplinary team. Mobility issue, you can refer to the physio team. Yes. If it's related to diet, you can also refer to the dietitian. And then moving to the psychosocial, you are looking at the patient's social life. So where the patient lives, is the patient married, whom the patient lives with, if the patient has any concern in any family member or any other person in the family. Or like you also ask about if the patient smoke or drink alcohol. If the patient is smoking or drinking, you ask if the patient has plans to quit smoking or drinking of alcohol. You ask about all these ones. And then if the patient is willing to quit smoking or drinking, can now seek their consent to refer them to the smoke cessation team or the alcohol cessation team. So yes, so that's about the psychosocial. And the spiritual, if the patient has any spiritual needs or the patient is subscribed to any spiritual belief, let's say Christian, Muslim, or non-believer. So you ask them if maybe they need any spiritual need, like letting their spiritual leader pray for them. You ask all these ones, and the patient might give you a response, and you act on that. And then you ask about the sexual preferences. So if the patient prefer maybe in terms of personal care, a male nurse or a female nurse, just ask about the sexual needs. If there's any, the patient will tell you. So after going through all these ones, you now talk about the other concerns of the patient. So if the patient has any other concerns, the patient will tell you, and then you address them appropriately. So after all these, you thank your patient, and then you make sure you leave the call bell. So the call bell is in the hospital. But if, let's say, the scenario is a community-based scenario, then it means you give the patient the GP details, or you instruct the patient to call 999 or 111 in case they have any concern. And then you make sure you clean the equipment, make sure it's ready for next use. You perform your hand hygiene according to WHO standard, and then you complete your station. So this is the end of this lecture series for the subdural hematoma or the neurological assessment. Thank you guys for watching, and then please like, comment, and share. If you are new, please do well to subscribe to my channel, and I'll be happy to make more educative videos like this to help in your studies. And good luck in your OSCE training, and then good luck. Success awaits you. Thank you.